Hey guys, it's Terri Harper, it's Biomedical again. We're here for our second Facebook live demo, our famous face decisions time. So we have two patients here that we're going to be talking with about surgical versus non-surgical. But before we get into that, I just want to remind you of a few things. Message us with your name and phone number during this session and you are entered to win the door prize. At the end of this session, we'll be drawing it. So only those people who are watching and message us with their name and phone number will be entered to win. And the door prize this session, because we're going to be talking about filler and everything, is 1 syringe of Juvederm Ultra Plus, which is a $550 value. So if you're interested in filler for anywhere, and we'll be talking about some places we'll put it, be sure to message us during this session, and when this session ends, we will draw to see who the winner is. A couple of other things. Dr. Lugo is going to be available this afternoon. She is our board certified plastic surgeon. She's going to be available for some mini consults this afternoon from 12 to 3. And also we have our open house from 12 to 5. And we have stocked the spa with gifts for teachers, for hostess gifts, for other gifts. We have our beautiful linens behind us on this table. All of those are on sale today. You can access all of our sales online until midnight tonight. So don't forget, if you can't join us, to do that. Today, everybody that spends $500 or more will also be entered into the daily drawing. So we had swag bags that were claimed early on. We had an overwhelming response to that. But today, if you spend $500, you're in a separate drawing at the end of today to win 50 units of Botox, a $600 value. So be sure and do that and get your order in either online or give us a call or come by during open house and we'll be glad to do that. Okay, so our two patients here today that we're going to be talking with about surgical versus non-surgical treatments are Molly and Pam. And Mary-Kate's going to talk to you a little bit about Molly and her issues as she sees them and what some options are.
So this is Molly, and today she presented with a little genetic pooch under her chin that's kind of been bothering her. So if you'll turn to the side and show us, you can kind of see right here. When we were talking, she mentioned that weight loss, diet, exercise, nothing has really made it better or changed it. It's just kind of always been there. So first we'll talk about the surgical approach. Our plastic surgeon, Dr. Lugo, she does a procedure called a short scar neck lift. She'll make a little incision under the chin here, and she'll smooth this out and improve the aesthetics of the neck. This is a procedure that she can do in the office. You don't have to be put to sleep. And you will wear a little compression garment for about 2 weeks. So that's really a great option for young patients like Molly that don't need a full facelift or any other procedures at this time. Another approach would be the non-surgical option. So we could do a little jawline filler to help lift, and maybe even a little chin filler to help kind of camouflage this pooch down here. So Molly, what do you think you would like to proceed with?
I think surgery.
Surgery.
And where could we find out a little bit more about the
So
short
Dr.
scar?
Lugo, she just wrote a blog on the short scar neck lift. You can find it on her website, and she also has some great before and after pictures.
Perfect. And I believe Rachel has also pinned that, included that link to that blog on our Facebook Live today, on our social media. Okay, so our next patient is Pam. She's in her early 50s, and you may remember Pam because we've treated her before. I do have a picture because we can't get the before and after of Botox immediately. So you'll see on this picture that how well the Botox has worked for Pam, especially in the forehead area here. So this is before and after her Botox, which we wouldn't be able to see today. But what we're going to talk about today is, as with most women in their 50s, they come in and I hear things like, my face is melting off, my face is falling off, those type of things like that. I'm saggy, I'm droopy. So that usually starts around early 50s. And Pam was no different. She came and said she didn't like the drooping in her face. Turn toward me, Pam, and we'll see. So what happens with that, as you get the descent of the face, you get this, what we call jowling area. and this little pre-jowl depression right here. I'm not sure how well we can capture that on camera, but when you turn this way, we can see here it is right here, and then that's a result of this jowl area here. So the surgical option for Pam would be a lower facelift that is done, by the way, in our procedure room in the office at at Aesthetic Center for Plastic Surgery at Spa Medical. And she is not put to sleep. The area is numbed, and Dr. Lugo would then do some incisions around the ear area and would pull this up, and while she's there would also get the neck nice and tight as well. So that is probably going to have a week, maybe a 2-week downtime, and include a surgical procedure for several hours that Dr. Lugo does, and she does very well. Again, she has pictures posted on Instagram and social media, so if you want to see some of those type of things as a result of that. Pam really, in my opinion, doesn't need anything on her upper face. She doesn't need a big brow lift or anything. Her brows are in great position. It's just the lower area. So non-surgically, when we make face decisions, the non-surgical option for Pam is going to be filler. We can do a lot with dermal filler. If you think about part of this sagging, drooping, melting that I hear is based on loss of underlying support structure of the skin. And so when we start losing those fat pads as we age, then the skin has no place to be supported, so it just wants to sag a little bit. So what we would do with Pam non-surgically is go in again and put a little bit of dermal filler up this way to lift this. We would put some dermal filler here to straighten out the jawline and to get rid of this little dip. This filler also helps with this depression here because we're basically lifting this back up. And in doing so, we're creating a parallel line to the cheek lift and the mandible or the jaw. So we're creating parallel lines here. Right now we have a line here, and this line is a little bit droopy here. So we're going to try to straighten that out non-surgically. And she already has great results from her Botox. So I think all we would do with her would be filler, probably 4 or 5 syringes to accomplish what we need to with Pam. So you can see pictures of this procedure that I've done in the past on our social media sites as well. And Pam, what is your decision, surgical or non-surgical?
Non-surgical right now.
Non-surgical right now. Okay, so what we'll do with Pam this afternoon offline is we will go ahead and do her procedure, and then join us at 2 o'clock this afternoon, and we will show the results of Pam's. Molly's surgery isn't scheduled yet, so we'll show that result at the end of her time there. But today we'll be able to see an immediate result with Pam, and then that result actually, I think, gets a little bit better in a couple of weeks, so we'll be able to share that. As far as Pam is concerned with non-surgical, there's very little downtime with that. The possibility of bruising is always there. Usually in these particular areas, I don't see a lot of bruising because just of the anatomy of the blood vessels and the depth of injection. But that is one thing that we would always consider, even though I usually don't see bruising here. If Pam said, I have a big event I have to go to tonight or tomorrow night, I probably would say, let's wait. Do you have a big event?
No.
Okay, so we'll go ahead and do that. I still would ask her not to do any kind of heavy cardio workout for at least 24 hours, and if she has any bruising, even a little bit longer than that. Is it going to break your heart not to work out today?
No, I'll be all right.
Okay, so it looks like we're a go for Pam. She's had these type procedures done before. And by the way, if Pam chose a surgical option, she probably wouldn't have to have these procedures done every year because she's going to buy some time for surgery with this, but she also buys a lot of time if she has surgery against needing anything like this in the past. So I love Molly's decision because it's a one and done. She will enjoy her profile for years to come until that time that she ages enough that she may need to have something else done. But several years down the road, she'll enjoy that, and it's a one and done. Pam will enjoy her non-surgical decision because she can get right out and go to the next Christmas party this weekend or whatever, so she'll enjoy that. So be sure to tune in at 2 o'clock, and we'll see Pam's results, and we'll have another door prize for you. In the meantime, between 12 and 5, we're open here for open house. We have some light refreshments, many consults with Dr. Lugo if you're interested in a surgical procedure. And we're all around and available today to be able to answer any other questions you have about our sales, our skincare packages, and what products you may need. So come on down and join us if you can this afternoon from 12 to 5. And then we will meet back again online at 2 and then at 4:30 for fun and games, multiple door prizes, and our grand prize drawing worth over $3,600 worth. So we hope to see you then, but right now we're going to choose the winner of 1 syringe of Juvederm Ultra Plus, and you can claim that by calling us and making an appointment to do it. So I have the winner of 1 syringe of Juvederm Ultra Plus is Michelle Furlot. I hope I said that correctly, but Michelle Furlot. Yeah, 1 syringe of Juvederm Ultra Plus. Congratulations, Michelle, and we hope to see you soon. Stay tuned for 2 o'clock, the reveal of Pam.